Hello, Derek Mahony here. I'm the owner and CEO of the lecture company Excellence in Orthodontics and Dentofacial Orthopedics. I'm pleased to announce that this is the first time that I'm taking my 20-year-old program that we've been running in Sydney to Auckland, and I'm working in conjunction with a great team of doctors there headed by Dr. Milan. And we have a website that I'd like you to visit, and the details of that website will appear below. But in the website, you will see that we have two programs to start. One is on orthodontic diagnosis and treatment planning, and that will be in March, 28th and 29th of March. The second program, which is linked, is continuation of diagnosis, but now adding ceptometrics and radiology. That will be in May, the 30th and 31st of May. Now, what I hope to cover in these two programs is how any general dentist, even with zero experience in orthodontics, can have a look at records and come up with an appropriate diagnosis. So one of the big things that I'm seeing as a trend medico-legally is a number of general dentists starting aligner cases and then getting themselves in trouble because they misdiagnosed a class 3 jaw pattern, etc., etc. So whether you do fixed braces or aligner therapy or myofunctional therapy, diagnosis is the key. And what I cover in this diagnosis is how to look at different records to come up with one of 54 malocclusions. If you go to YouTube and you punch up my name, 54 malocclusions, there's a free 1.5 hour lecture that gives you a bit of an inkling on what you'll learn. I'll teach you how to take good quality records, and that includes the photographs, the radiographs, the study models, but more importantly, how to analyze those records to come up with the treatment plan. And there's a differential treatment plan, straight from APRA regulations. You write to the patient and you say, based on the records, we would suggest the following treatment options. 1, do nothing. 2, expand the upper jaw. 3, wait till growth is complete, adult teeth are there, and maybe consider extractions. You've got to go through all the treatment options available to the patient, and we'll help you at the end of this course to actually write a letter to the patient, and we go through informed consent. So for anyone wanting to incorporate orthodontics into their office, this is the core foundation series of lectures, right? Now, I go through all the theory. My good friend and colleague, Dr. John Rosa, will then supplement the theory with clinical information. And the clinical information will be a practical hands-on. So all the things that, that I teach you, such as how to properly trace Jefferson, you'll do with John under supervision. When I teach you how to take proper photos for digital smile design, John will show you with the camera. So John's coming over to Auckland on Saturday, Sunday, 2nd and 3rd of May. So this is the packages you have. You can come and just do the theory, but if you're not doing it regularly in the office, I'd recommend supplement it with the practical. You can just do one course, but ultimately the two are linked. So I would suggest you speak to Milan and see what he can work out for you as a deal to do course 1 and 2 combined. Now, after doing course 1 and 2, you may then wish to register for the entire mini residency. And what's been difficult in the past is the clinical component. Many New Zealand doctors have done the hard yards, flown Auckland, Sydney for 3 years. That's all well and good if they want to listen to me lecture, but then practically sometimes you need to be in a clinic every fortnight or every month to get the most out of the lecture content. And in that regard, we've worked with 2 of the big clinics in Auckland that allow you to do hands-on within New Zealand, which is a first ever. We have a very good support team. So Dr. Talia is an orthodontist who will help you online with all the records you upload and case-by-case help. Clinically, we have Milan and AJ, who are previous students of mine and have been doing a lot of high-quality orthodontics in New Zealand. So there's a support team to help you. So when you start orthodontics, it's not like something you've done like an advanced course in crown and bridge or an advanced course in root canal therapy, because you were exposed to that and you were taught that as an undergrad. Here, you probably weren't exposed to a lot as an undergrad, so it's all new, and sometimes it's very confusing, and you follow one guru who has one treatment plan, and then you find someone else who has a totally opposing treatment plan. I don't push one type of brace over another. I'm more interested in you getting the diagnosis correct. For instance, if someone is class 2B, which you'll learn from diagnosis, that means their mandible is retrognathic, then you need to bring that lower jaw forward, and you need to bring it forward at the appropriate time. Now, how you bring it forward, Mara, Herbst, twin block, that's really up to you, and I don't care. But I'd be very unhappy if the patient had this problem and you took out upper premolars and pushed things back. This is the thing I want to teach you. Conversely, if you have a patient who's 2A, normal mandible, protrusive maxilla, that would be a case for retraction. So I'm going to go through the diagnosis in detail, and I think even if you pursue a non-career in orthodontics, meaning you decide to do these courses and then refer and not do orthodontics yourself, you'll still become a better referrer because you know when to refer, which cases to refer, and at what time, etc., etc., right? So that's the brochure that they put together. If you email the team, they're more than happy to send you that information. So the website is www.eodo.co.nz. So www.eodo.co.nz. That website has all this information. Both AJ and Milan are available to pick up the phone at a prearranged time and talk you through what's involved. It's always good for a doctor to speak to another doctor, okay? In the last 10 years at EODO, I've only employed dentists to work for me, even in admin. Why? Because they get it, right? So what I'm trying to do is cut and paste the success we've had in Australia and bring it to New Zealand. I love New Zealand, and as many of you know, I'm involved in a vineyard there, and so there's more than one reason for me to attend. But I'm not just doing it because I want to visit the wineries. I'm doing it because I want people in New Zealand to be offered this great opportunity so they can pass on the skills they learn and really benefit the patients they're treating. My research and my whole career has been based on early interceptive treatment related to airway. So we'll have a number of ear, nose and throat doctors that also lecture to you during the program, telling you how nasal obstruction problems can be linked to adverse facial growth, can be linked to increased malocclusion problems, can be linked to all sorts of problems associated with concentration at school, bedwetting, etc., etc. So it's a more holistic program. Many programs offer straight teeth, meaning you treat the kid with permanent dentition, you resolve crowding by extraction, you put braces on, etc., etc. We're teaching a holistic approach, and that is 3 stages of treatment. Early intervention to change swallowing habit, improve breathing, what we call orthotropics or myofunctional therapy or growth guidance or healthy start, etc. The phase that's really important, and that's changing jaw position and size, dentofacial orthopedics. That's what we're very strong on. And the last thing, we still teach you orthodontics. You'll learn about aligners and how to do fixed braces. But really, if you do the early correction, the complexity of the case is minimized, and many of these kids don't even need fixed braces. So I welcome you to join myself and my EODO New Zealand team to start the program. Numbers are limited because there's a hands-on component, so please pick up the phone, have a chat to Millen or AJ, and I look forward to seeing you in Auckland.